That is tremendous news, with over 8,000 tests conducted in 24 hours. But of course, as Dr Young said, the next 10 days is very critical, so we need to make sure that as many people as possible, if they are having any symptoms, to go and get tested. Can I thank everyone who has gone and been tested? We still need more people to go and get tested, and I thank you also for your patience. There have been some queues. We know we have a number of clinics that have been set up across the southeast. I thank you for your patience, but it is very important during this time, if you have any symptoms whatsoever, to get tested. So we know that social distancing is the key to make sure that you continue your social distancing, that good hand hygiene, and hopefully we will get through this as soon as possible. Our testing turnaround is around 30 hours, and that's because of the large volumes that we are seeing, but it is wonderful news that we've had 0 overnight cases. Dr Young will give us an update, but I just wanted to also mention that because we've got the Jeff Horn fight happening up in Townsville, some extra measures have been put in place by Queensland Health, and that is that Queensland Health will be greeting people coming off the flights into Townsville just to check that they have no symptoms. This is because we have a large number of people from Indigenous communities that are coming to the fight. It is very important that no one goes to the Jeff Horn fight. If you have any symptoms, you must stay at home. So we're putting in this extra level of precaution just to make sure that everyone is safe at that event. And of course, I'm going to wish Jeff Horn all the very best. I'll hand over to the Deputy Premier and then the Chief Health Officer, and we're happy to take any questions. Thanks, DP.
Thank you, Premier. Well, we breathed another sigh of relief this morning to learn that there were no further cases of COVID-19 here in Queensland, although there, of course, is still a long way to go before we know we have controlled this possible outbreak. That leaves our total number of cases at 1,106. 18 of those are active. As the Premier said, we did 8,059 tests in the last 24-hour period. 6,278 of those were in the HHSs where we are concerned about the Youth Detention Centre cluster. I want to apologise to those who saw delays in getting testing, particularly at Redlands. Today we will open a further fever clinic at Gundapar in the Bayside, hopefully to relieve some of the pressure on the Redlands. I just emphasise that in terms of redeploying health resources from across the southeast, first and foremost, we've had to relieve a number of staff from the Ipswich Hospital Emergency Department who were potentially exposed there. We have also allocated significant resources to our hotel quarantine, which remain at near peak levels, and that has impacted our ability to stand up many more fever clinics, but we have extended the hours of those that are operating. The Chief Health Officer will outline in more detail early preliminary results from that genomic testing she has been talking about. Those early results indicate that the first case of the Brisbane Youth Detention Centre cluster had the same strain of COVID-19 as one of the women who travelled to Melbourne, as well as the diners at the restaurant thought to have acquired it from that person. That doesn't disprove the theory that they are related. It doesn't prove the theory either, because that strain, the B1125 strain, is the most common strain currently circulating in Victoria. Therefore, there could be other sources of that strain here. Further genomic testing will, though, be able to confirm if the two are indeed linked, we hope.
So no new cases overnight, so we still have those 5 original cases associated with the detention centre, staff who work there, 5 cases in their immediate household or immediate relatives, and we've had no community cases. It's still a little bit early, though, to be seeing those community cases, so it is really important that everyone with any symptom at all come forward and gets tested. And thank you to all of those people who came forward yesterday and got tested. So we'll get those results through today, and that will reassure us, I hope, that we've not had community transmission. We'll need to continue those testing levels for the next week to just make sure that there isn't a case that we've missed, because I'm beginning to think that is what has happened with this detention cluster. So we now have that early genome sequencing information. So it looks like this cluster has the same viral strain as one of the young women who went down to Melbourne. Now, as the Deputy Premier pointed out, that doesn't prove it. I need more information, which is being done over the next 24 to 48 hours to be able to prove it. But at this stage, it does look like they could be linked. But we don't have the case between the two clusters. So we've had the cluster related to that Melbourne Logan group of those 5 people, and the cluster related to the Brisbane Youth Detention Centre, 10 people. There's a missing link between the two. So that's why it's so important that we do our absolute best to find every single case, because the cases we don't find are the ones that can lead to chains of transmission if we don't find them and then can't get on top of them and manage them. So thank you again to all of those people who came forward yesterday and got tested. Then we are doing a little bit of extra work up in Townsville just because of the event that's happening there on Wednesday night. I've just asked the health staff up in Townsville, could they please go to the airport and meet each flight that's coming in and just reaffirm with people that if they're unwell, that's not the time to be going to the event. So we'll also be making sure, and I know that those event organisers have an excellent COVID-safe plan in place, and we'll work with them if there's anything else they need to do, just in case there are people who were to travel up from Brisbane. I think the risk is very, very, very low. I really do. I think the numbers of cases here in Brisbane, you can imagine how many millions of people there are in Brisbane, and for one of them to have it and then to go up to Townsville, the risk is very low, but it's not going to hurt just to remind people of that who are travelling into Townsville Airport. Thank you.
Would that person still be out of the community, or you just don't know?
They could be, which is why testing is just so critical. So yes, there could have been a person there, well, there has to have been someone there who's been the link between the two clusters, if that's what's proven. Remember, I don't have that final information, but if that's what's proven, there will have been a link, a person between the two clusters. We don't know who that person is, no, because we haven't tested anyone. So I have been doing serology on all of these people who have been in the Brisbane Youth Detention Centre to see if any of them might have had it and recovered, and they could be that missing person. So people might remember I did exactly the same thing up in Cairns. So we had one case, then a month later we had a second case, and they couldn't be related. But then I went and did serology testing and we found 2 people who'd had it, and that was the missing link.
Does that mean the 77-year-old woman is not the zero case?
No, she's not the zero case for the cluster. There will be someone else that has led to the outbreak, yes.
Dr Young, what's the latest on tracking down the people that left the detention centre in terms of finding them and testing them? Well, we've got some latest sort of...
Yes, so police have tracked down 91 of the 94, which is excellent. So they know where they all are, but they've physically laid eyes on 91 of them. We haven't got all the results on all of those yet, so we're going through those today.
Are some residents refusing to be tested at all?
No, they've all been very good. A few of them have been a little bit reticent, as you can imagine. Most people are. This is unexpected, but all of them have been very helpful. Thank you.
Are there any inside the centre who were due out about an hour of being tricky?
No, we're not keeping anyone in there who shouldn't be there. Of course not. This is a detention centre. Once people have finished their custodial sentence, we're working with them.
There was more than 500 staff affiliated with the Youth Justice Centre. Have all of those workers been tested now, as well as the detainees?
Yesterday, last night when I went home and got the last information, we were still waiting on 16 people to get tested, staff, because they've been on different shifts, they've been away, so we're just tracking down those last few. But the vast majority have now been tested. Yes, we were waiting on one last test last night on the detainees. Right. One of the relatives, who was a confirmed case, was admitted to the Ipswich Hospital for another condition on the 19th of August. So we've had to contact trace all of the staff because she was admitted during her infectious period. So not necessarily symptomatic, but during the period that she could transmit the virus. So we had to go and contact trace staff, and quite a few staff had to go into quarantine. Yes, she was positive. I don't think they are, and I'm so grateful that people are prepared to manage those long queues. That is extremely good of them, and we are standing up extra clinics today to try and help with that.
You advised yesterday wear a mask if you can't social distance. What would your advice be to school teachers, and particularly young students who can't social distance?
Yeah, we have to remember that school children, and we're seeing it again in the Youth Detention Centre, are not the people at risk, are not the people getting it, and not the people spreading it. So my advice in schools is be careful of the other adults. So in the tea room, in the playground, in the before and after school, it's the other adults that are the problem. Staff meetings, we've seen some outbreaks happen when staff have had meetings. That's the real risk. It's adults with adults, and we've seen it again in the Youth Detention Centre. It's adults with adults that are the risk. This is not flu. With flu, the major spreaders are children. We know that. With this, it's adults.
And the 8,000 tests overnight, where would you like to see that? 8,000
I think that's good. Yes, I think that's a significant testing proportion. But really, it's more than the number. It's about people who are sick. It's really, really important that if someone has any symptoms at all, they're the ones I want to test. They're the ones that will find the cases, and they're the ones that are critical.
Just more broadly on the masks directive you issued yesterday, there's been discussion now of, from the Transport Union, for example, encouraging commuters to be wearing masks. What is your sort of definitive advice, if you like, for wearing masks in a public space?
If you're in a public space and you can't maintain social distancing, then that's the time to consider wearing a mask. I'm not mandating it. I do not think it's reached that risk, but I'm saying that you should make your own decisions so people know whether they're more at risk. So people, I'm positive, we're 7 months in, have a good understanding of what their personal risk is if they were to get the infection, and then where they need to go about their normal business. So they should think it through and work out, and always talk to their own doctor is always a good place to start if they're unsure.
Would it be your preference for them to wear a mask?
No, I think it's up to people to make their own decision at this stage. I think we've got really good COVID-safe plans. We've had months and months now to put them in place. We know them, they're in place, people have been activating them very well, and I think that's the important thing we should focus on.
Another family of wealthy Victorians have come into Queensland and been given an exemption, this time on a super yacht.
Yep.
The current affair has vision of this crew and family getting off the boat in New South Wales on Friday. How have they been given this exemption?
I don't know that specific one, but we do give exemptions for anyone who's been on any sea vessel for 14 days and not been into an area of risk. Because,
New South Wales has been declared a hotspot and they were there on Friday.
well, I'd have to see that, because of course if they've been in New South Wales they need to go into quarantine when they come into Sydney, into Brisbane. That's absolutely clear. But I'm not sure that I know about that one. I do know about a number of super yachts that have come into Queensland because we're quite a important place for repairs for a lot of those super yachts. We have a significant industry in that, and so the plan is always, if they've been out at sea for 14 days or longer and they have their logs, so we work closely with Maritime Safety Queensland, who checks their logs to make sure that they've been out at sea and they haven't gone to any areas that might have COVID, they haven't had any new people coming onto that vessel, then they get tested. So they still have to have a COVID negative test, and then they can leave.
But they got off the boat in New South Wales.
As I'm saying,
New South Wales is declared a hotspot.
of course.
How are they coming into Queensland waters?
Well, they're not. If they've been in an area within the 14 days, they need to complete 14 days quarantine.
All that happened yesterday is they were given a COVID test and they're on the boat in Queensland.
As I said, they have to complete 14 days quarantine. So that happens no matter who you are. You need to complete quarantine for 14 days after leaving a hotspot, whether that's overseas, Victoria, New South Wales or the ACT.
So what is the next step for them? Will they be taken off this super yacht and taken into hotel quarantine for 14 days?
I would need to know the specifics of that, but that is the process.
Dr. Young, you've spoken a bit about the scientific linking of the two clusters. What have you done in terms of linking them, talking to the Logan women who went to Victoria, and have you established any link such as relatives or friends of theirs that are in the detention centre or were in the detention?
No, we haven't established any of that link through our contact tracing process.
There was a highlight story. We've had a case in a Melbourne man who was told on Friday by somebody who felt that he could fly for his mother's funeral. If he went into quarantine, he wouldn't be able to go to the funeral or go back immediately into quarantine or go back to Victoria. He was told, after flying up, he was told on Sunday, no, he couldn't. Why is that sort of thing happening?
I'm not sure about the specifics, but I've not allowed anyone right from the start of this pandemic to attend a funeral who's come from a hotspot. Right before we brought in border restrictions for international visitors, I've never allowed it because we know from evidence around the world, and it's been reaffirmed recently, that several of their outbreaks in New South Wales have been as a result of attendance at funerals. Funerals are really, really high risk because you can't socially distance. I mean, to say to someone who's grieving that they can't hug someone, you can say it all you like, and I know the funeral industry has very, very good, solid COVID-safe plans in place, but they're very hard to manage. And we're now allowing 100 people at a funeral, and that hasn't changed, so it's far too high risk. So I'm not sure what happened, but I apologise. He should never, ever have been given any advice that it was okay to attend a funeral.
Can I ask, Queensland's pitching today in the AFL Grand Final. What can you tell us about the cases of the AFL?
Look, what I can confirm is that the AFL are now speaking to states, and I can confirm that myself, Minister Kate Jones, Tony from the Gold Coast Suns and Andrew from the Brisbane Lions will be speaking to the AFL about the potential that Queensland has, and Brisbane in particular, to host a grand final if and when the Victorian government and the Victorian AFL makes a firm decision that it cannot go ahead in Victoria.
What's the main selling point? What should be pitched? Why should it come?
Well, we've hosted over 50 games to date. By the end of the season, it'll be over 80. We can put on world-class events. We have put on the Commonwealth Games that people from all around the Commonwealth got to see. And the sport is growing in Queensland. It's up 30%, so there's enormous potential here in Queensland. But like I said, these are very, very early days, and I think I'll just leave it at that for now. Sorry? I'm not going into any of that detail. This is purely an opportunity for Queensland to talk to the AFL. Very, very preliminary discussions. Sorry? Absolutely, Patrick. Of course, we want the Brownlow, and if that was to occur, we see an enormous potential for the Gold Coast to host that. The Gold Coast has done a great job in the past of hosting the Logies, and of course the Commonwealth Games, so we think there is enormous potential.
There'd be no parade. You couldn't do a parade.
No.
In relation to these families who come from Victoria via a super yacht, how have they been given an exemption, considering they stopped?
I don't have those details. There will be a thorough investigation. The Deputy Commissioner and Dr Young will look at the details of that. I don't have those details to hand. If you want to provide those details, they will be immediately looked at. And as Dr Young said, if they've been to a hotspot, they have to go into quarantine just like everyone else.
Premier, one asserted that there's more than enough PPE in Queensland, and yet the AMAQ have put out a statement saying that GP clinics in particular are consistently unsure of how much and what's available. What's your response?
Everyone's been out and seen our PPE stockpile. Of course, that's primarily for our hospitals, but of course there is a lot of masks and everything readily available on the open market. But I'll ask Dr Young if she can address the AMA question. If there's any other questions for me first.
Can I ask, why has Queensland implemented less COVID stimulus than Victoria and New South Wales when their unemployment rates are high?
Yeah, well, that's a very good question. So let's address that. We have already put in place $7 billion. We have already committed our $50 billion capital program over the next 4 years. We have brought forward $13.8 billion the next financial year for capital infrastructure, and we will have more to announce over the coming weeks and the coming months. Let me make it very clear to Queenslanders, our priority is to get people back into work. We are very much focused on what are the skills and training that people need who have lost their jobs. And let's remember, a lot of people have lost their jobs. It's going to be very tough for these families, but we need to hear from the people who've lost their jobs what industries they would like to go into. We're also looking at the regions by regions as to what areas of skills we need, particularly to those areas. We've got a key focus on manufacturing as well. We want Queenslanders to back Queenslanders and buy more in Queensland. These are the key things that we're focused on, as well as small business. We know that the best way that we can help people get a job is to make sure that we have the right economic framework for that. That is exactly what the Treasurer and I are focused on.
But why have we spent less?
Well, we've spent more on our capital program.
Deb's releasing some engineering designs on her Bradfield scheme today. When are we going to see yours? Are you going to reveal all before the election?
Patrick, we have spent over $1 billion on water infrastructure. We are in the final stages of putting together our key group of people that will be working on our water infrastructure proposals as we look to the future and what Queenslanders need. And of course, you might want to ask the LNP how they're going to pay for their promises, because if they've got all these billions of dollars worth of infrastructure, there's only one way they can pay for that, and that is to sell our power assets. And I'll tell you what, there's been reports about that in the paper today. Queenslanders do not want their power assets sold. We keep that in public hands. We've been able to give Queenslanders back a dividend, and plus we are giving Queenslanders, every household, $200 as part of our COVID response to ease the pressure for cost of living during this particular time.
You spoke about water infrastructure generally. Are you cooling off on the idea of the Bradfield?
No, we've got a committee we're about to announce, and that will be looking at a version that is possible and one that is affordable.
How is it fair that these wealthy Victorians can come into Queensland and be given an exemption when families can't see their loved ones, can't get an exemption to see their loved ones go to funerals?
Yeah, look, I've addressed that question. We are going to investigate it. If you want to hand over the details, I'm more than happy to look at it. All right, and we'll hand over to Dr Young and then the Deputy Commissioner. And just before I hand over to Dr Young too, can I also commend all of our agencies that have been working especially around this youth detention cluster. What's going to happen over the next 24 to 48 hours, for the first time I think in Australian history, we are going to transition in a whole new workforce. This is only possible because we have agencies across government that are able to work together. And they're able to work together because we have worked together to respond to cyclones and natural disasters and bushfires. People know one another, they know their strengths, they know their expertise, But this is a huge job. It is absolutely the right call. It will have a combination of a whole youth justice workers, corrective service workers, operational controls going in there to manage that detention centre to make sure it continues to operate, as well as wearing PPE. This is what happens when you respond quickly, and I want to pay tribute to the Youth Justice Department, but also corrections, police and health that have worked around the clock to ensure that this happens. I've never seen this happen anywhere else in Australia or the world today. Thank you. Dr Young.
So Queensland is now manufacturing its own PPE, so there should be no problem with all of those primary healthcare practitioners, whether they be GPs or pharmacists, accessing PPE. If there is, the Commonwealth still has a stockpile, and I've alerted them to this change in policy here in Queensland, and they've ensured that the primary healthcare networks who provided the PPE at the start of the pandemic for primary healthcare have got sufficient. So they will be able to access PPE. I'm not concerned about it. At this stage, we could not have done what we're doing now at the start of the pandemic. We did not have enough PPE. We definitely do now.
But there's clearly some kind of breakdown in communication if the AMAQ say that their consistent feedback from GP clinics is that they're running low on stock, they don't know what's coming, there's no transparency of the process, there's clearly some
Well, they're private businesses. If they need assistance, they can look on the website, they can look where you can purchase PPE. There is plenty of PPE out there. You and I can go to the local shopping centre and we'll be able to buy PPE. So seriously, there is plenty out there. If they really can't find it, they should call their local PHN. That's been set up by the Commonwealth to provide that sort of advice to primary health care so that they can then be given assistance how to go about and buying PPE.
Deputy Commissioner. Thank you, Dr Young.
Good morning, everyone. Just a quick summary of what's happened in the last 24 hours. We've seen 68 flights come into the state, 3,199 passengers processed, 14 refused entry. At our road borders, we've had 3,109 vehicles intercepted. We have refused entry to 107 persons, and we've had a total of 554 people go into quarantine in the last 24 hours, which indicates how busy our borders are. In relation to breaches of the directions of the Chief Health Officer, we've seen 2 on-the-spot fines issued in the last 24 hours, one including for a false declaration at a border, which regrettably takes the number of people trying to breach our borders through either deception or avoiding them reached 77, plus another 19 before the courts for serious offences related with that. So, of course, the matter that got some attention yesterday around the kebab shop in the Fortitude Valley, a corporate PIN has been issued to the operator of that business for $6,772, I think it is. And we are continuing to look at the vision of that to make sure that there are other businesses that are not implicated. So the message around that, of course, is that whilst the vast majority of Queenslanders are doing the right thing, it's particularly disappointing that we see people trying to breach our borders and not doing their bit around social distancing. I've said it a number of times that we will maintain the borders. They can't be 100% effective. The rapid response you've seen is very effective what's happening around the cluster around the Brisbane Youth Detention Centre, but the community's role is to practice social distancing and do that well. We've seen some instances lately where in some occasions people are just doing the wrong thing. So we'll continue to police that and continue to make that. And I might preemptively address the issue around exemptions. There is a very clear process for getting exemptions to come into this state. We apply that equally to whoever that person may be. There are exemptions for coming out of the hotspot, but nonetheless there are requirements for people to go into quarantine. And certainly, as the Premier has mentioned, I will look personally into that particular issue and ensure that everything has been done properly in that instance. And if it has not, there'll be further investigations. Thank you.
The public has suggested that some refused detainees left the Wakehole facility and were subsequently picked up by police at Road. Is there any truth to that?
Look, I've got no specific information around that particular issue. I can tell you that there were 94 released, as Dr Young has indicated, and we found 91 of those children. So police have located 91 of those. The other 3, we're in contact with the families and carers of them, and we're confident we'll track them down soon. I'd leave it to the DG to talk about his centre. You know, he's across far more detail on who may be released from his centre or not.
But have police at Ferny Grove picked up, if you like, any youth detainees who escaped from...
Not that I'm aware of. Thank you.
Yes, that's okay. Just very quickly. Yeah. Thanks, everyone. And can I acknowledge the Premier's comments about the huge task in terms of the workforce swap over? And just another example of the great cooperation across government. Today we'll launch a legal profession hotline. It's specifically only for legal practitioners that can't get advice through their normal processes. So we'll provide that so there's great coordination between the legal profession, youth justice, courts and health. And can I just say one thing while I'm here? We're thinking about our own staff and their families that have been affected. Thanks, everyone.